Hello, today I will be presenting on panic disorder, exploring its physiological processes, the role of neurotransmitters and hormones in the autonomic nervous system, and as well as effective treatments. We're also going to look at how cultural and individual factors influence how we manage and treat this disorder. Let's get into it. Panic disorder is characterized by recurrent, unexpected panic attacks, which are intense periods of fear or discomfort. Symptoms of panic attacks can include heart palpitations, sweating, chest pain, and shortness of breath. These attacks can occur suddenly, without warning, and they often leave individuals feeling as though they're losing control or even dying. Panic disorder is not just about the physical symptoms themselves, but also the intense emotional distress that comes with it. That's why we're talking about both the emotional and the motivation and how those play into panic disorder. During a panic attack, the autonomic nervous system is activated, which triggers a cascade of physiological responses. The autonomic nervous system controls involuntary bodily functions, and during panic attacks, its regulation becomes disrupted. So this leads to symptoms such as increased heart rate, rapid breathing, sweating, all of which signal a heightened state of arousal, even though there's no actual danger. So let's look at the autonomic nervous system. Like I mentioned before, right here, as you can see, the brain and the red part that comes down through here, that is the autonomic nervous system. As I mentioned, it controls, regulates the involuntary functions. So it's going to help it speed up and help them slow down, both coming together in fight or flight situations where maybe you need your body to be heightened, and it also controls your body to calm down after an event. Now, this is the sympathetic nervous system. So the autonomic nervous system is broken down into two parts, the sympathetic and the parasympathetic nervous system. The sympathetic nervous system is going to be that immediate system that kicks in, which is known as fight or flight. It prepares the body to respond to perceived threats by increasing heart rate, elevated blood pressure, and heightened alertness. During the panic attack, the sympathetic nervous system becomes overly activated, which leads to the typical, like I said, fight or flight response, even in situations that are not dangerous. And that's the concern with panic attack, is that you have the sympathetic nervous system that's kicking in situations where it doesn't need to kick in. On top of that, with the parasympathetic nervous system, it's what's responsible for calming the body after a stressed event. It is, as you can see here on the left side of what it controls, the involuntary responses that happen. It works to bring the body back to a calm state. So it decreases heart rate, it decreases blood pressure, which just promotes overall relaxation. However, in panic disorder, not only is the sympathetic nervous system kicking in areas where it shouldn't, the parasympathetic nervous system is often slowed to even engage after a panic attack, which just prolongs feelings or fear and discomfort. This delayed response makes it more difficult for individuals to return to a state of calm. Moving on, panic disorder is influenced by several key neurotransmitters and hormones. Neurotransmitters such as serotonin, norepinephrine, and GABA play critical roles in regulating mood and stress responses, and their imbalance can contribute to panic attacks specifically. Hormones like cortisol and adrenaline are released during stress and contribute to physiological symptoms of panic attacks. So let's dive into these neurotransmitters and hormones in a little bit more detail. Now, looking at our neurotransmitters, there are three that are involved in panic attacks. The first is serotonin. Now, serotonin helps to regulate mood and anxiety. Low levels of serotonin have been associated with increased anxiety, which can lead to panic attacks. Norepinephrine is associated with arousal and the body's stress response. And in panic disorder, this neurotransmitter may be elevated, causing the body to enter into a heightened state of alertness. Gamma aminobutyric acid, or GABA, is an inhibitory neurotransmitter that helps calm the brain. And in panic disorder, GABA's reduced function leads to a lack of inhibition, resulting in overactive stress responses. So as you can see, when many of these neurotransmitters are not working correctly, they can act as an avalanche, only furthering the problem of panic disorder. Now, the two hormones that are involved in panic attacks is cortisol and adrenaline. Cortisol is known as the stress hormone, and it's elevated during panic attacks. While cortisol helps the body respond to stress, prolonged elevation can increase anxiety. Adrenaline, on the other hand, is released by the adrenal glands and triggers the fight or flight response. During panic attacks, elevated adrenaline levels cause the body to experience rapid heart rate, heightened blood pressure, and rapid breathing. Now, the fight, flight, and freeze that we keep talking about is activated during panic attacks. It's an automatic reaction to perceived danger. Now, it's designed to prepare the body to face or flee from a threat. However, in panic disorder, this response occurs even in the absence of real danger, which leads to unnecessary feelings of fear and anxiety. When the system is overactive, individuals feel as if they are in immediate danger, triggering uncontrollable anxiety. Now let's look at the causes of panic disorder. There are many, and they're complex, and a lot of factors that play into panic disorder. Some of these factors may include genetic factors, which suggest hereditary predisposition to anxiety disorders. Another is environmental factors such as trauma or stress. Both can act as triggers. Cognitive factors involve misinterpretations of normal bodily sensations, leading individuals to perceive them as signs of danger, entering into that fight or flight. Additionally, biological factors such as overactivity of the amygdala contribute to heightened fear responses. And then finally, the psychological theories, which is learned behaviors and cognitive distortions, things that were picked up throughout the years that have been adapted and played in. Now, panic disorder is often comorbid with other conditions, including generalized anxiety disorder, GAD, agoraphobia, depression, and substance use disorders. The physical symptoms of panic attacks can mimic those of heart attacks, which can lead to cardiovascular conditions. Individuals with panic disorder are also at an increased risk for suicidal ideation and behaviors, making it very essential to address both the emotional and physical aspects of this disorder. Evidence-based treatments for panic disorders. There are a few. Effective treatment for panic disorder typically involves cognitive behavioral therapy, CBT, medication, and therapeutic techniques. CBT helps individuals identify and challenge negative thought patterns and confront feared situations. Medications like SSRIs and SNRIs can help regulate serotonin and norepinephrine levels, while benzodiazepines provide short-term relief for acute panic attacks. In therapeutic techniques, there are several, and we're going to dive into them in just a second. Looking at cognitive behavioral therapy for panic disorder, We know that it includes techniques such as cognitive restructuring, which helps individuals address those negative thought patterns, as well as exposure therapy, where clients gradually confront feared situations. These techniques help individuals reduce their anxiety and reframe their responses to stressors. Next is medication. Medications are commonly used to help manage panic disorder. SSRIs, such as fluoxetine, help regulate serotonin levels and reduce anxiety. Benzodiazepines provide short-term relief for acute symptoms, while SNRIs are effective for treating both anxiety and panic symptoms. Therapy techniques for panic disorder may include relaxation training and breathing exercises, which help reduce the physical symptoms of panic attacks. Mindfulness-based interventions, on the other hand, can teach individuals to observe their thoughts without judgment. And then finally, psychoeducation can help clients understand panic disorder, reducing fear and empowering them to manage their symptoms. In the end, support is crucial for individuals with panic disorder. Family and peer support help to foster understanding and empathy. Professional support from therapists, psychiatrists, and support groups is also essential. Additionally, self-care strategies like mindfulness, regular exercise, and healthy lifestyle habits can improve overall well-being. Community resources can also be beneficial for panic disorders, with panic disorder support groups and education programs being available to those going through panic disorder. In conclusion, panic disorder is a complex condition that affects both the emotional and physiological processes of a person's life. By understanding the physiological processes, such as the autonomic nervous system, neurotransmitters, and hormones involved in panic attacks, we can better support individuals and help them manage their symptoms. Treatment options like CBT, medication, and relaxation techniques work together to reduce symptoms and improve quality of life. It's essential to consider cultural differences and individual needs when developing a treatment plan for panic disorder, ensuring that each individual receives the support they need to manage their anxiety. Thank you.